Ladies and gentlemen, namaskar and welcome to the 15th edition of the Jaipur Literature Festival, protected by Dettol, Banega, Swasth, India. We are delighted to introduce our next session, The Pandemic, Public Health and Policies of Concern. At a time when global solidarity is crucial for our planet, rich and privileged nations have continued to disappoint with their short-sighted policies. Even as popular sentiment and misinformation drive out rationality, the assessments of medical and technical experts and informed epidemiologists continue to be sidelined. A distinguished panel comprising Chandrakant Lahariya and Ambarish Satwik discussed the need for a measured, verifiable, and data-based approach and policies aimed at ensuring public health and vaccine equity for the most vulnerable, in conversation with Lakshmi Puri. Chandrakant Lahariya is a medical doctor, columnist, and author who has been at the forefront of the COVID-19 pandemic response in India. Lahariya, a leading epidemiologist, is amongst India's widely acknowledged public policy, vaccines, and health systems experts. His opinion pieces appear regularly in The Hindu, The Indian Express, and Dainik Bhaskar. He has also co-authored the book titled Till We Win, India's Fight Against the COVID-19 Pandemic. Chandrakant Lahariya, please. Thank you. Ambarish Satwik is a vascular and endovascular surgeon and writer. He is director of the vascular cath lab at Sir Gangaram Hospital, New Delhi, and professor of vascular surgery at the Gangaram Institute for Postgraduate Medical Education and Research. He's the author of the critically acclaimed novel Perineum, Nether Parts of the Empire. His columns and opinion pieces on a variety of subjects have been published in the Times of India, India Today, Outlook, and Tehelka, amongst others. Our moderator today, if you could also have you on stage, sir. Our moderator today, Lakshmi Puri, is a former IFS officer and ambassador. She served at the United Nations for 15 years as director of the International Trade Division, the United Nations Conference on Trade and Development, and later as the Assistant Secretary General at the UN. She's also the founding Deputy Executive Director of UN Women. Puri is a distinguished fellow of the Indian Association of International Studies and a recipient of the prestigious Eleanor Roosevelt Prize for Human Rights. Ladies and gentlemen, the pandemic, public health and policies of concern, Chandrakant Lahariya, Ambarish Satwik, in conversation with Ms. Lakshmi Puri. Thank you.
Good afternoon, and it's such a pleasure for me to be able to talk on this topic, very burning issue of the COVID pandemic with the foremost experts in this area. But more than experts, I think what has been their forte is that during those 2 years and 3 waves of the COVID pandemic, they have been, Dr. Satwik and Dr. Lahariya, have been, if I may say, guides, if not oracles, and a source of sage advice and assurance through the media, which at that time, and it has continued to play a very important role, whether it is TV and radio or the social media. So we are talking here today about the devastating global pandemic which hit India hard and which put it through what I have in my articles, which I have written right from the beginning of the COVID pandemic, called Agni Pariksha, the trial by fire, literally, and which called for, and I think evoked eventually, a King Bhagirath-like response from all of government, all of society response from all Indians. It is no easy task. Both of you have not had an easy task being those guides and oracles and frontline uh, frontline icons. Because even as we have seen the pandemic passing through, there is been so much struggle, even amongst the best experts in the world, on the verities of this war against a wanton, completely unpredictable, insidious, and what we have called Bahurupia COVID virus. So let me begin, however, with a celebration of what we were able to achieve as India, as one India, in the area of vaccination. At 7 a.m. today, India has vaccinated 1.8 billion people, or 1.8 billion doses, and covered 98% of 18 plus as first dose, 95% of 15 plus included, all eligible population, and 80% of eligible population, that is 15 plus, given the second dose. It takes one's breath away. And I would like you to please clap to that. It's an incredible, and the world has recognized this. It's an incredible, awe-inspiring, world record-breaking, largest vaccine development, free for all, equity, and universal coverage in telescoped time story. So I would like to ask our two panelists here, what is the secret recipe? How did we reach here? Was it that India's healthcare system, which was otherwise not so strong, rebooted in record time, established and managed a highly complex system of cold storage, transportation, logistics, credible reporting systems, faster testing, trail and compressed delivery schedules, which I've already referred to? And also, have we also seen unprecedented coordination at the national and state level, between the national and state level? Never mind the politics, there was that politics there, but despite that, when we all came together, and then between various departments, agencies, vaccine manufacturers, civil society, frontline workers, public-private partnership, decentralized operations, as well as strategic centralized framework for vaccine procurement and distribution. So, and then also indigenous development. In another panel, there was a reference to what was indigenous and what was manufactured. But it is a combination of Mission COVID Suraksha, the indigenous development, with global technology transfer to reinforce India's moniker as the pharmacy of the world. So I would like to very much hear from you. How did we do this? And also not to forget that Indian people have shown the lowest vaccine hesitancy. As has been said by our leaders, including Prime Minister Modi, that this is an example of political will, sabka saath, sabka vikas, sabka swasthya in this case, and sabka prayas and vishwas, because it is the trust in the whole vaccine system that was forthcoming. So please, and I apologize for a longish introduction.
Thank you very much. So the word pandemic has a Greek root or origin, which essentially pan means all, demos means people. So a disease which is falling upon all people is a pandemic. So to fight a pandemic, we require response from every single citizen in different roles. So that's how pandemics are fought, with the participation of all people. Of course, it requires a more nuanced and closer examination. There are many dimensions. We have gone through many lows and highs in last 2 years of pandemic, but COVID-19 vaccination in India, though initially a bit of struggle was there, but in the end is something which we can take pride that India, being a low and middle income country, could vaccinate 95% of adult population in such a short time with the 2 vaccines which were being either produced or indigenously developed. So itself shows the potential a nation could have. Having said that, what we need to remember that any health intervention, any response to a disease or health situation require whole of the society approach, where governments take some policy decision, technical expert work on those decisions to implement them, and citizen participate. As an example, in COVID-19 vaccination, it is not enough that if country produce enough vaccine. It is important that people come forward and take vaccination. So if there is a 95% of adult population fully vaccinated in India, the credit go to every stakeholder: government, which made the policy; manufacturer, which produced the vaccine; and citizen who came forward. And that's how we can do it. How India could do it? India could do it because India has a strong and robust COVID-19 vaccination program per se, especially targeted for children. And in the last 4 decades, that program has matured. There is sufficient delivery mechanism, the vaccinators, the cold chain system, the supplies mechanism, the production capacity. And that's how we are fighting pandemic, and we are at a verge of where we can say that the epidemic, COVID-19 epidemic for the country is somewhere close to be over, and soon we can hope we will be in the endemic. So my final point here is that while we should celebrate success in COVID-19 vaccination, it is a reminder that there are many health challenges in India, many health problems in India, which are insufficiently tackled. If we can succeed in one front or one area, we can definitely succeed in other areas. So we need to derive lessons and learning from COVID-19 vaccination of India, that how other interventions can also be strengthened and how India's health system could be strengthened. Thank you.
Dr. Satwik, absolutely.
Well, I would entirely agree with Dr. Lahariya. India is a country the size of a continent.
Mhm.
So to undertake any public health exercise is a massive task. I mean, think about it. New Zealand has the population of roughly South Delhi and West Delhi put together. So look at the volumes you're dealing with. And I am completely in agreement that the vaccination program has been a remarkable, remarkable feat, and one of the great pillars of our fight against COVID. There's no denying that.
Thank you. So let me once again remind our audience about this book, which has been written by Dr. Chandrakant Lahariya, along with Gagandeep Kang and Randeep Guleria. All 3 of them were very prominent in the communication during the pandemic. So let me ask you, both of you, what are the communication-related challenges? It's very important during a pandemic to communicate with the public, not to do certain things, to follow certain protocols, and also at the same time, not to panic. So what do you think are the main components of such a communication strategy that governments should have as public policy, but also individuals like you who have a standing of your own? How should you be communicating? And what have you learned from when you were communicating?
Thank you. I think another learning from COVID-19 pandemic is health communication and science communication. If we recall the COVID appropriate behavior of face mask, physical distancing, or hand washing, they are widely known, but to these interventions, which are really preventive, become habit of individual, we need to communicate. It's not enough to say that these COVID appropriate behavior are followed and then you will be prevented from COVID-19. It is important in health communication and science communication tell that why one need to adhere to particular behavior. It need to understand the concerns of the people and challenges people might have in adoption of such behavior. So health communication and science communication is integral part of success of any public health intervention. That is true for vaccines also. There are people, and especially adult vaccination program. Let's go to the same example. This was the first time in India's history or many countries' history that such a large scale adult vaccination program was being done. So children are vaccinated and all of us believe in vaccines for children, but never ever such a large scale or mass scale adult vaccination was done. So if people have to adopt a new behavior, somebody who is in early 40s, 50s or 60s may not have received any vaccine in the past. And we are asking that individual to receive particular vaccine. So it need to be communicated why these vaccines are important, why each and every single individual need to be vaccinated. It is also equally important that we address the common concerns, myths and fears and apprehensions. We also need to acknowledge that I being a medical doctor, that while doctors are good at treating patients and giving individual advice, but they are not always best at the public health advice and broader science communication. They can communicate the technical aspects of a disease or treatment, but they may not be able to explain in the simple language. So one of the learning in this COVID-19 pandemic for every aspect of pandemic response is that governments need to have a more sustained, regular communication with the citizen, highlighting the importance of healthy behavior. The health expert need to learn to better communicate with the citizen. The citizen also need to know what are the reliable and trustworthy sources of information. Citizen also need to know that they should not fall for the fake or misinformation. So COVID-19 pandemic is definitely revelation and learning that how important health or science communication is there and how each of us, policymakers, technical experts, medical doctors, and citizen can contribute to keep society healthy and prevent from such kind of challenges.
Doctors.
I'll give you examples of actionable messaging, for instance. This is a respiratory mucosal pathogen. And think about it. The message that is always given is stay away from crowded places, all right? But if you're wearing a tight-fitting N95 mask, you're virtually invincible, right? Because people have to go and work. People have to earn a livelihood. The message that is of vital importance is that this disease can spread before the person manifests symptoms. All right, what that means is that you will normally get it from someone you know, because you're without a mask in the presence of someone you know. Usually in the presence of strangers, you're always masked. In the presence of people you know, you're not masked. So you're more likely, when the case count in the city is very high, you're likely to get it from someone you know, right? Second, this is aerosolized. Aerosolized means that you're able to breathe out the virus and it spreads in a cloud-like fashion. Take the analogy of cigarette smoke, okay? If you are in one corner of a room and someone's smoking in the other corner, you'll still be able to inhale and make out that someone's been smoking. That's precisely how the virus spreads. It spreads as an aerosol. Also, if you walk into the room after 15 minutes, if someone's been smoking there, you know that there's been someone smoking there. That's precisely how the virus behaves. This sort of messaging is equally important. So one must realize that it's not just physical or social distancing that's enough, but it's the fact that you can carry on with your lives if you're adequately masked in the middle of a pandemic, be productive, earn a livelihood if you're taking the right kind of precautions.
I would like to ask you, Dr. Lahariya and Dr. Satwik, how do you think this whole issue of global solidarity, cooperation, and consultation of policies should happen. Because as we have seen, and as COVID-19 has shown us, that we live in a very interdependent world, and and interdependent even pan-India, because one state has, there is an infection that starts in one state, it spreads to others. So in that context, what are the things that I have written a lot on how global institutions should be rebooted, reinvented, strengthened, including WHO, in biosurveillance, in pandemic-related biosurveillance, in monitoring of and predicting, early warning, as well as when it happens to be able to find the origin of the virus. So all of that. And then there is the concept of global One Health. So how do you think we can do better in terms of international cooperation? And also vaccine equity. There are so many countries in the world that do not have and did not have access, still do not have access to vaccines.
So in context of infectious diseases, we often hear three terms: outbreaks, epidemics, and pandemics. The first thing to remember is that these terminology are not based upon severity of disease. They are merely based upon geographical spread of disease. So if a particular disease condition is in a small geographical area, it is called outbreak. If it's spread to a multiple geographical area or multiple countries, it's called epidemic. And when it is in many countries, it becomes pandemic. So SARS-CoV-2 started as an outbreak initially in Wuhan, China. When it spread to many countries, it was declared as epidemic. So you remember that first case was reported on 31st December 2019. And that time it was outbreak. In much of the January and February, it was considered epidemic. And then 11th March 2020, World Health Organization declared this as a pandemic. So these are the only geographical distribution and not determined by severity. Disease could be severe or other. Now, when it comes to pandemic, of course, we know that if there is a bigger geographical spread, it requires global participation of all countries. You cannot fight pandemics with countries thinking inward or about themselves only. We have seen this in case of vaccine inequity, that vaccines were available in limited number of countries, or many countries were giving vaccines to their own population repeatedly, while there were parts of the world which were without vaccines. And what we saw that because other parts were not being vaccinated, there were emergence of new strains, and so even those who were repeatedly vaccinated were unsafe. Short message: in the pandemics, all countries need to work together. It had not happened from the beginning on many fronts, but fortunately or hopefully we will learn these lessons. Other thing to remember is, and I often speak at different fora, that there are two terminology we use interchangeably. We say international collaboration or cooperation. Another term is a global collaboration. And there is a fine nuanced difference, in my opinion, in these two things. When we say international collaboration, essentially what we are doing, we are still believing in national boundaries, and then we are thinking, okay, whatever is left, we will go to other nations. But when we talk about global, we need to see it's in a single unit that everyone should be protected. And there are organizations, international agencies, which are thinking that vaccines should be pooled. They should be distributed as per the needs of the country, not per the which resource is coming. I think there are many learnings from this ongoing COVID-19 pandemic, but one of the learning is that there had to be stronger global collaboration where the resources are deployed as per the need of that nation. Of course, a country needs to think of its own, but alongside, the equal attention should be given to global collaboration. If we can learn about that, or we can forge those mechanisms, probably we will be better prepared for future epidemics and pandemics.
Dr. Satwik, can I ask you another question, which is, are we seeing the end game? I think all of us want to know. Are we seeing the end game of the pandemic in the latest Omicron wave, which has passed, seems to have passed? And is the pandemic close to its end, or there is more to come? And which variants and what variants, and how do pandemics end anyway?
Well, it's a fool's game to predict, but usually pandemics end when the virus runs out of people to infect, which means that the virus has managed to touch practically every population and every kind of geography, or vaccines are strong enough to actually immunize the individuals against getting infected. That's how pandemics sizzle out, and there always will be pockets of immune naive people in every country, in every city, in every community, which will be vulnerable. And these are pockets where who are likely to get infected again, or sometimes immunity wanes, and people are likely to get reinfected. And this is the meaning of the term a disease being endemic. Endemic doesn't necessarily, or it doesn't at all mean that the disease has become milder. It just means that it's run out of fuel, it's run out of people to infect, and it will find in its own sweet time the remaining set of people. It also is equally important that one must keep surveillance up during these times, because what happened with Omicron, in my view, there's in fact a paper that was published that's come from China that that speaks of how Omicron possibly happened because the virus jumped onto mice and underwent a series of mutations in mice and then came back. So it's like a reverse zoonosis. And what's fortuitous for humankind is that the series of mutations that happened in mice was such that they made the virus less virulent. And therefore, when you have a slightly less virulent virus and you have your population that is bolstered both with vaccination and previous infections, the virus is not able to cause damage. So Omicron basically managed to infect everyone. It is possibly the second most infectious viral agent known to mankind after measles. And because it spread like wildfire, and a lot of people didn't even realize it touched them, it has managed to give some semblance of that mythical term called as herd immunity. And therefore, unless there is a very drastic antigenic shift, which means that the virus undergoes a mutation, possibly from leaping onto another animal and then coming back, and undergoes a major antigenic shift that our immune systems are completely unable to recognize. It seems to most experts that if not being endemic immediately, we are clearly on the path of achieving endemicity.
Just a quick comment on this one. Like, I think this is a very common question asked. People say that, are we entering into endemic? As Dr. Satwik highlighted, from pandemic to endemic, it's not binary. It's not that right now, like 5:30 p.m. on a particular day you are on pandemic, and then 5:31 you will be endemic. It's not like that. What is important, we need to remember that pandemics start with a virus, but they become endemic with a socio-political consensus. What it means that when a society starts accepting that the risk posed by a particular pathogen is not worth to put life on the halt, and then it becomes endemic. So, as an example, United Kingdom, Sweden, Denmark had removed majority of restrictions, COVID-related restrictions, without calling it endemic. And when they removed those COVID-related restrictions, the number of daily new COVID-19 cases in those settings were more than the number of daily new COVID-19 cases were being reported in the previous peak. So this is a kind of a society accepting the risk. That's the one part. And second dimension, we need to remember that, of course, in the beginning of pandemic, or when a virus or pathogen is new and large population is susceptible, every single case count matter. But with the time people being vaccinated or exposure, the infection lose its meaning. What matters now, or a certain point of time onward, or when people are protected, that what would be the outcome of that infection. And we know with the time, even if infection happens, when we are talking today, cases in some settings are rising, but the impact of the rise in the cases is not the same. So society would reach on those stage of pandemic. And final point here is that good news is that pandemic would be over. The only part is we do not know when, but it will be over soon. And we should be prepared for that.
Okay. So now let me take you back to the basics, which was that when COVID-19 first hit us, people like Bill Gates and Nassim Nicholas Taleb, they said that we told you so. We said that this would happen. And in Taleb's case, he said it wasn't a black swan event, that it was not unpredictable or rare or catastrophic event and it should have been anticipated. Do you agree with that? And if yes, then are we looking at a 10-year or a 100-year time frame for the arrival of the next pandemic? I would like both of you to answer. And then how can we be future ready? Even if we had known, suppose, that it was coming, could we have known that it was this? And how could we be future ready? I know that in your book also you have addressed this.
So in COVID-19 pandemic, we have heard a common reference of great influenza pandemic 1918-20, and which sort of gives a message that the last pandemic happened 100 years ago. That is not true. Many of you might be surprised to hear, and some of you might be knowing that last pandemic happened in 2009 and 10. Swine flu H1N1 pandemic. So the last pandemic was in a decade ago only, and there have been pandemics since 1918-22 till now, many pandemics. It's just that the impact of those pandemics were not that severe. As I said earlier, the pandemics are not related to the disease severity. The original SARS in 2002-4 was far more fatal. Like I think 10% of the people who got exposed to the SARS severe acute respiratory syndrome original virus in 2002-4 died. There is another virus, Middle East respiratory syndrome virus, which has reportedly killed 1/3 of all people. So severity of disease is not linked to the pandemic, it's a geographical spread. And we were lucky or fortunate that the last pandemic was not that severe, it subsided. But having said that, we need to remember a few core fundamental principles. With every passing day, we are getting closer to the pandemic. The reasons are increased urbanization and people are living in close contact. The faster mode of transport means an individual can move from one part of the world to another part of the world within 24 hours or even less. Which also means that the individual can move, then the virus or pathogen can go to that part. The deforestation essentially means is increasing risk of pandemic, because if forests are being cut, the virus or pathogen which were till now in the forest are coming in human contact and we are at risk. Similarly, the climate change can result in increased pandemic risk because the viruses or pathogen which were not surviving in a particular temperature, with the increase in temperature, they can survive longer and cause disease. The single animal battery farming, where large scale animals are produced, so antimicrobial resistance, indiscriminate use of antimicrobial. Yeah. So humans are doing everything possible to ensure that we reach closer to, or faster to the next pandemic, and we need to stop that. And that's why we all need to do something in this direction.
Dr. Satwik, would you like to talk about being future ready for a pandemic? If it's going to happen so frequently.
That's right. No, I mean, there are 2 points I'd like to make here. First is, obviously, I completely agree with Dr. Lahariya that most of these pandemics that have happened and that are likely to happen are going to be zoonosis, which means these are viruses that are already circulating and reproducing in animals, various kinds of animals. And we have to take that call about how much urbanization, how much growth and development is right, how much deforestation is right, because it is going to increase proximity between animals and humans. And it just takes one mutation for the virus to successfully reproduce itself in a human host, and there you go all over again. It just takes one person to start a pandemic. So, but to be future ready, I think a remarkable feat has been achieved in this pandemic, which is that, first of all, internationally, we were able to produce a vaccine in the middle of a raging pandemic. Mm-hmm. And it is believed that the mRNA vaccine platform is a remarkable platform, for instance. I mean, I can't give you exact dates, but roughly about 3 or 4 days after the genome of SARS-CoV-2 had been revealed, there was a model vaccine ready with Moderna. Right? That's how quick this technology is. And a fascinating thing about mRNA vaccines is that it is a biochemical process. It doesn't take cell biology. It's very quick to make. So preparedness would actually mean setting up technology for mRNA vaccines. You know, there's a company called Rovi in Spain, which manufactures millions of doses of the mRNA vaccine for Moderna. This company has no previous experience of making any vaccine. Why? Because you don't require a vaccine manufacturer to make an mRNA vaccine. All right? There was a report which identified 100 companies in India that could manufacture sterile pharmaceutical injectables that are capable of manufacturing mRNA vaccines. It doesn't take too much. So all we need is, this is again part of international cooperation, for transfer of technology, for sharing technology, so that it's very easy for an mRNA vaccine to be upgraded. Let's say there's a new variant of COVID. It will take just 1 month for a new reformulated mRNA vaccine to be pushed, as opposed to 6 to 7 months for a regular vaccine. So it's always good to have this technology. I think this will be part of the preparedness for any kind of pandemic.
Okay, thank you very much. Now we would like to open the floor for questions. Yes, sir. You in the first row. Oh, yeah, this gen.
My question has to do with, if we're looking back 26 months, lessons learned. If we had acted perfectly, what would have been the perfect way of treating the COVID epidemic?
Thank you for your question. I believe the question is for me, or should we both take it? Right. When you have a tremendously infectious viral particle, which is capable of causing respiratory illness, there's no way of stopping it. So I think one of the lessons is there is no such thing as zero COVID. You can just push the can down. All right. What governments can do through interventions is basically, to use that very cliched term, flatten the curve. The area under the curve doesn't change. The only way to get from pre-pandemic to post-pandemic is if every individual has been somehow touched by the virus or by a vaccine that immunizes against infection from the virus. That's the only way of getting from pre-pandemic to post-pandemic. But when you've got a tremendously infectious particle, the only thing you can do is to control the faucet. How to allow the virus to wash through the population. This is through mitigation, very smart policy, and rapid vaccination.
Yes, sir.
Hello, Hanji.
Your question. Yeah.
So very nice presentation. So what explains its resurgence in Hong Kong such a devastating way and overwhelming the systems of Hong Kong, which is happening right now?
So we are also hearing in other settings rise in the cases, and even in China cases are rising. So what we have learned in COVID-19 pandemic, that every country and every setting is different. For example, Hong Kong or China, many experts are saying the rise is happening because those population continue to remain susceptible. They did not experience that kind of transmission as India or European settings or United States has seen. That's one part. Second part is the response. For example, in many countries have used a different vaccine. For example, China used inactivated vaccine, and we know the benefit of inactivated vaccine is relatively less in comparison of mRNA-based vaccine or viral vector vaccine as being used in India. So every setting is different. What Dr. Satwik also highlighted, the key is that to prevent future impact of the disease, infection probably we cannot prevent that well, but impact in terms of hospitalization and death, It's important that people receive vaccine preferably, because if you are vaccinated, you are protected without risk of hospitalization or death. Or the other alternative for future protection is natural infection. But that's not the preferred choice, because natural infection carry the risk of severe disease, hospitalization, or death. So in the end, everyone need to have some protection, preferably by 2 shots of vaccine. If that is not possible, like they will be protected by natural infection. So that's partly explained, but experts are still exploring that deep, clear answer.
Good
So
evening.
next question.
Yeah, good evening. My question is for both the panelists, and it is broadly related to mental health. It has 2 aspects. First is the mental health of the frontline workers, what they've seen in last 2 years, how close they have been to death, and the mental health of doctors in general. We don't address this question often. And the second is about we people in general, the way the policy changes have modulated our preferences, lockdown and contactless delivery, hand sanitization, etc., etc. So how do we as individuals make sure that our mental health stays sane? How are we not socially anxious? So these are 2 questions.
Well,
Thank you.
I think, again, I would say that the mere fact that you are asking question about mental health is a leap forward. The reason is that 2 years ago, or like earlier, people were never talking about mental health as a health issue. While the fact is that in 1948, World Health Organization, its definition said that health is a state of complete physical, mental, and social well-being. So mental health is part of physical health or overall health. It was never discussed. One of the, of course, pandemic has impacted our mental health, but the positive side of that is it has brought mental health to the forefront, and we started recognizing the need for mental health care services. In most countries, and especially low and middle income country, India, like for example, India has total 4,000 psychiatrists or the specialist doctor in mental health services. The mental health services are not available. I would say that, and also another positive development in COVID-19 pandemic is that the stigma which was associated with talking about mental health has little disappeared. Now people are openly and upfront talking about mental health services. What is required that we continue this dialogue. Government need to strengthen mental health care services, and we go like to a provider to seek mental health care services. That will change a lot of things, but there is a long way to go in that.
One last question now. We are coming close to the end. Yes, the gentleman in front.
My question is for Chandrakant sir. From epidemiologist's point of view, COVID awareness, which includes COVID appropriate behavior, was only taken seriously after the second wave. Whether fighting the misinformation regarding the vaccine. Sir, we see LCD TVs being installed in Gram Panchayat during assembly elections. So do you see, for COVID awareness, do you see it as governance failure? And second question, so could COVID become seasonal flu like swine flu when we talk about endemic?
2 parts. Like one, it is pandemic because this is a new virus and we did not know enough about it. How pandemics are fought, like their impact cannot be reduced, but if your health systems are prepared, if you have a good, effective or functioning surveillance system, you can minimize their impact. And we know that vaccines could be produced because there was a research and work going on for years on the vaccine production and research. So how quickly vaccines could be developed is a very good example of how preparedness in the response to pandemic can minimize their impact. That's one part. So in wisdom of hindsight, of course, there would be challenges and there would be learning and which should be utilized. Your second question is related to, second part of your question? Well, of course, there is historically any virus when it is identified, it never disappears completely. Like only virus which is not there on not circulating in smallpox is still there in laboratories, and polio is on elimination. Otherwise, virus do not disappear. We do not know enough about SARS-CoV-2, the virus which caused COVID-19, but it's very likely that it will stay with us. With vaccines, we will be protected, and then some people need to follow. This is something which we would learn in due course, but we need to know that it will be with us, and hopefully it will be milder or it will not cause any major impact.
Would you like to add anything? Or No, we'll take another question. You've already asked? No, okay, please. One last question now, and I'm closing.
Yeah. In the US, CDC recommends that flu shots may be taken twice a year. So can we see similar recommendations for COVID vaccines also?
Any recommendations on vaccination will have to be based on evidence, and preferably evidence generated from the local, from the country where it will be implemented. As of now, there is no such evidence. It has been established, and there's wide-ranging evidence that 2 doses of practically any vaccine available to you protects rather well from severe disease and death. And in the absence of a new variant, I don't think there'll be any point in constantly taking vaccines. It's entirely possible that a new variant will have if it does arrive, will have complete immune escape to these sets of vaccines, because these vaccines were developed for the original grandmother virus, so we have so many iterations down. So I think, which is why my point about getting mRNA technology, this is the quickest format of producing a vaccine and rolling it out.
Thank you very, very much, Dr. Lahariya and Dr. Satwik, and thank you for the big hand to them. And we are here because there is a respite in the COVID-19 virus. And we are here together celebrating this Jaipur Literature Festival. But also, I think we've got assurance that the end is in sight. Thank you all.
We'd like to thank Dr. Lahariya, Dr. Satwik, and Ms. Lakshmi Puri for this rather insightful and interesting discussion. And we do hope the pandemic does come to a very abrupt end, perhaps in the next minute, but that's not going to happen. But we hope to see you at the next session. The festival is not coming to an abrupt end just yet. It's still tomorrow evening, and also the music stage in Amer tonight. So we hope to see you at the next session and next and last session of day 4. Thank you.
Thank you so much. Thank you.
Signed copies of Dr. Lahariya's book are already available at the bookstore. There is no author signing this time, but you can obviously catch them outside if you want to get your book signed. I don't guarantee you'll be able to catch them outside, but please do try.
श्रोताओं, मैं महेश चंद्र त्यागी, रिटायर्ड जिला शिक्षा अधिकारी, अपनी